In this video, I'm interviewing Dr. Frey, a dental surgeon who's travelling New Zealand at the moment, giving seminars, and he's also authored this book, Free Your Smile. Basically, big question marks about the dental industry in New Zealand. He'll also be speaking at the NZDSOS, which is New Zealand Doctors Speaking Out with Science conferences on the 21st and the 28th of September. And I also will be speaking at the NZDSOS conference on the 21st of September, which is in Christchurch. And I'm also travelling New Zealand doing the Great Health Awakening seminars, the New Zealand tour, all about what are the driving forces or the root causes of disease. It's a solution-based seminar. So I'll make sure that all the links are in the description below. In the meantime, could you please comment, please watch this interview, and please, of course, share it. It's so important that people are informed so that they can make the right choices. Thank you for watching. The correlation between poor oral health and chronic disease is now evidence-based. Now, in the Brilin studio, we have Dr. Fred, a dental surgeon. Thank you very much for coming in. Now, at the Brilin Centre, we're absolutely adamant that poor oral health could be the root cause of disease, or if someone already had a disease, poor oral health could perhaps prevent someone from totally healing. Would that be a fair enough comment?
I think it's a good start, although I often turn it over. It's like I see in the mouth the health of the patient. So I believe there is not something as separate as oral health and another health. This is the overall health. I think it's all one human being with one health system, which works together. Mm-hmm. And there are fascinating aspects about that when you look at what has been happening in biology over the last 2 decades. One of the things I like to educate about is the oral microbiome, but it's not part of just a separate thing again. It's a big oral health total microbiome that goes all the way through your body.
So just a bit of background about who you are. You're an author. You've authored a book about oral health, so I'll get you to introduce that. And also you're touring New Zealand at the moment. What's the purpose of your tours at the moment?
The purpose is simple. I have done, since I'm in New Zealand, coming from the Netherlands since 15 years, a kind of dentistry that was, and I wouldn't even call it holistic, I rather call it natural, which means, yes, we still use a few chemicals, like mainly white filling materials that are, of course, made in a chemical industry. But they are selected as being the ones that are the most natural, or at least the least chemical, the least toxic. And but that's just one part of it. I think the most important thing is there's too much dentistry as there is too much healthcare, in my opinion. And everyone's complaining, oh, there's not enough healthcare, there's not enough doctors. I think, in heaven's name, you can heal nearly everything yourself, and even with teeth. Yeah? And okay, now and then, maybe when you're not so careful with your chainsaw, you might need a hospital. But better be careful. And I think that's the same thing as with dentistry. Of course, you can have trauma and fall on your teeth, and then you might need a bit of dentistry. But you can prevent so much. You can prevent so much. And then still, I think it's a good idea to once in several years visit a dentist and maybe have a check and a clean or something, but not every 6 months. I don't think that's necessary. I think 80% of dentistry is unnecessary.
So tell us about your book. What is it called?
The book is called Free Your Smile, and I really wanted to have free in there, not only because the first 3 letters are my name, but what we have been through in the last 3-4 years is kind of a path towards something that, in my feeling, was necessary and is still necessary to make us more aware of something that must change. And and a lot of people think, well, after COVID, everything should go back to normal again. Well, normal wasn't that bad, maybe, as it seems to be now, but that normal is also not what I think was a great one. The healthcare industry is, at this moment, the most profitable industry in the world, and that's not a good thing. And that's the main thread through the book. How can we do more ourselves? How can we empower ourselves to do more preventative stuff?
Well, that's really admirable, but I'm a little bit concerned. As a dentist, you could be struck off for this sort of information, couldn't you?
I think the main problem at this moment is that when you're in healthcare, you're hardly allowed to think outside of the box, let alone speak outside of the box. And there are many boxes, and the boxes get,
tighter and tighter
and tighter. I myself stopped working during the mandates. After that, I didn't trust the whole system, the dental council anymore, the way they handled this whole thing. Well, already 2 dentists and a child of a dentist, and later on multiple dentists died after the experiment. I didn't want to be part of that anymore. So I thought, well, let's start doing something more important, and that is educate people how to organize to get out of the hands of this medical system, including a very, how would I say, a dentistry where there is too much happening. There is a lot of treatments that you do not want because they are damaging your teeth. And someone has to start saying this, and that someone needs to be me.
Well, that's really good. I've just finished doing the South Island tour called The Great Health Awakening, and part of my talk I talk about oral being one of the big driving forces of disease, and I tend to demonize root canals a little bit, and it's because of what we've witnessed over the last 14-15 years, and also what other practitioners around the world and medical professionals talk about this gangrenous tooth, which is rotting from the inside, leaking bacteria into the body, and the bacteria pooping, thus being a huge precursor to disease. In fact, we've actually witnessed people who just cannot get well, and they remove their root canal, all of a sudden they get really well. Now that's them. It's not necessarily everybody that will happen with. But it's quite interesting. I won't name the town that it happened with, because it won't be fair on these particular dentists. But just after I finished my little spiel on oral health, 2 people stood up and walked out of my talk. And it's only by chance they left the phone on the seat that I called out to them and said, "Excuse me, you've left the phone there." And they come back to pick up their phone, and they then announced, we're dentists, and we don't like what you said. And I tried to engage in a conversation with them, admittedly in front of an audience, and they couldn't really answer. They couldn't really deny what I was saying, but they just didn't like what they wanted to hear. And I thought to myself, it was actually a really good lesson. I'm not sure if cognitive dissonance or, why would they not want to engage or learn or enter into conversation about that? Is it, and I'm not being arrogant, this could be completely inappropriate for me to say this, is it guilt? Maybe. Like if you're making money, making a living off something that could potentially be very harmful. Don't know. What's your thoughts?
My thoughts is you're indoctrinated in dental school that this is the way and there's no other way. From the start on, if you don't have an open mind and just ask the question why at least 10 times a day, then you probably all swallow it, and that's an easy way to make money. So why would you change? And I think that was too easy for me. I always wanted to know why. I find out what works and what doesn't work. Well, root canals just don't work. They seem to work for a few years, but it is the lowest success rate treatment in dentistry. So only for that reason, apart from other reasons, I would not advise it, because it costs a lot of money and you will lose the tooth anyway, in most cases. So that's one aspect that made me not want to do it. I have trained with a Japanese professor to just do a minimal invasive root canal treatment, which is actually almost starting to avoid it. And what I do now in my talks is actually telling people, if you're able to be in time with your hurting tooth, so it's still important at some stage, first learn a little bit of self-diagnosis so that you know when to go to the dentist and when not. So that's part of the training first. It's also in the book. But then if there is a reason that you do need to go, then what you want is something that is called ART, A-R-T. It's a Dutch invention, which is if you have a deeper cavity, that can happen. Maybe you couldn't prevent everything, and sometimes that is the case when you have very deep fissures, deep grooves in your teeth, so that they're actually really hard to clean. So these are places where still decay can start, even with people who do perfect prevention. Well, suppose you got that, then you start feeling some pain. It starts being annoying. First, usually with cold, and then it lasts a bit longer, start lasting longer. At some stage, well, maybe I should see a dentist. Well, in that case, that particular case, it's particularly good to just go to the dentist and let it check, and then maybe have a filling, but not just simple filling. You can do something that is ART, which is a filling done in such a way that it is atraumatic, not traumatize the tooth, not traumatizing the nerve. And it is also done in small steps, and really important at this very moment, you can do it without anesthetic. Because at this moment we start seeing that anesthetic seems to be contaminated with all kinds of particles that we really think shouldn't be in there. And we see that all over the world at this moment, and in New Zealand we see it in nearly every anesthetic. So at this stage I would say it's even more important that you have your filling done without anesthetic, and it is possible with ART, or what the Americans call biomimetic dentistry, which is also a very precise art of doing a filling in very small steps and in such a way that you hardly feel it. Well, that's what I'm promoting at this moment, because I feel too many dentists want to do things too fast, and they do not put the effort in to make it into a nicer kind of treatment in which they try to avoid to take too much tooth material out. And that used to be a real big problem in the amalgam time, because then, especially with the dental nurse problem in New Zealand, they were trained pretty badly, had extremely bad equipment, so they could only make one size fits all, which was a huge filling. And you can actually do microscopically tiny little fillings when you do it with ART.
Interesting. Couldn't we just resolve all tooth issues just by adding fluoride to our water?
No. Fluoride is proven not to work. Almost all the research done in the areas where fluoridation is kind of selective research, which means that maybe you take 3 cities, you compare them each other, and one city that didn't have fluoride comes out as best tooth-wise, and then you take that city out of the research, and then you can change your research in such a way that it looks like that fluoride works, but it's just not true. It's just nonsense.
I've only met you, half an hour ago. In fact, I actually, disrespectfully, I had to ask the pronunciation of your name. So I had no idea, who you are and what your objective is. I assumed that because you're speaking at the NZDSOS conference that, yes, you probably did have problems during the mandates. So are you speaking at the NZDSO conference in September 2024?
Yeah, I'm part of the break, and I actually do not really make a very long speaking engagement. I made a special video there that touches on the subjects of the jabs being contaminated, and especially the deal about finding dentistry minimal and trying to engage into this other type of dentistry so that you can go to the dentist without needing a jab. But if you want to go deeper into this, then at the 22nd of September here in the Brilin Center, we do another workshop. And before that, we actually start the week before in the Dunedin. Then we go to Invercargill. Then we go to Oamaru. And later on in the other conference in Auckland of the NCDSOS, the day after I give a workshop in Auckland. There's still room there. And there's another one in Wellington 2 days later. So if people want to go there, then they can book via my website.
I'll make sure all the details down below. Thank you very much for coming into the Brilin Centre for this video. And I'll see you, of course, at the NZ. We've both got a talk probably similar time in the NZDSOS, and then the next day on the 22nd, you'll be here giving a talk. So I'll make sure all the links are down below. Thank you, Dr. Frey.
Thank you, glad to be here.